Good afternoon, everyone. If I was asked you to think about the typical heart patient, who might you imagine? Let me tell you about one. Played ice hockey, by the age of 51 had quadruple bypass and 4 strokes. Attended cardiac rehab to put back the pieces and to try and prevent further heart health problems. Would you imagine a man like that? This patient's name is Marianne Finucane, and she's a graduate of Women's College Hospital's Cardiac Rehabilitation Program, a program that was designed exclusively for women and the first of its kind in Canada. When Marianne was describing her cardiovascular problems, she told us, "I felt like Humpty Dumpty being pushed off the wall again and again. With every setback, I was gutted. But the cardiac rehab team was there to help me pick up the pieces, patch me up, and encourage me to get back up onto that wall again." Through cardiac rehab, she regained her strength and stamina and her confidence about her heart health. And she was also surrounded by a community of inspiring and supportive women. So why do we need a women's focused cardiac rehab, or research, or care for that matter? After all, we all have a heart. It's not specific to women. But we know that there are significant gaps when it comes to heart health for women in Canada. And we refer to these as the 5 significant unders, 5 unders that put women at risk when it comes to cardiovascular disease. At Women's College Hospital, we're trying to address these unders. And the good news is, our community in cardiology is making progress in these unders and improving diagnosis and treatment for people like Marianne. So today I want to tell you about these 5 unders, how we're addressing them at Women's College, and why we have reason to be optimistic. So the first of the unders that we talk about is under-researched. Even today, 2/3 of research into cardiovascular disease is done in men and male animal models. But men and women aren't the same. We have different physiology, and women have different biology across the lifespan. So let's take menopause, for example, a time in a woman's life when she's at significantly increased risk of cardiovascular risk factors and cardiovascular events. Can we do research into men and animals to look at the effects of menopause on women and heart disease? To my knowledge, one of the only animals known to go through menopause is the orca, or the killer whale. That's not much help when it comes to doing research in women, menopause, and cardiovascular disease. As we heard from Vincenza, women can present differently with symptoms when they're having a heart problem. And we sometimes refer to this as atypical symptoms, but I personally prefer to refer to this as a female pattern of symptoms. And this is important because we know that symptoms of heart attack are missed in up to 57% of women. So we need to increase our awareness of cardiovascular disease in women. So the next thing I want to talk to you about is underaware. So if I ask the women in the audience, what do you worry about most when it comes to your health in general? What would you say? A Canadian study has shown that women believe that they are much more likely to die from breast cancer than they are to die from heart disease. And yet we know that a woman is 5 times more likely to die from a heart attack than to die from breast cancer. Not only that, she is more likely to die from her first heart attack than men, and she's more likely to have another event, within 6 months of that first heart attack. And we know that this is particularly important in women. So let's move on to awareness of risk factors. So in addition to the traditional risk factors like diabetes, high blood pressure, cholesterol, smoking, women have a constellation of unique risk factors that are under-researched and under-treated. And at Women's College Hospital, we are addressing these unique risk factors, novel risk factors that need to have further research. So I want to tell you about some of these risk factors. Firstly, pregnancy. Did you know that pregnancy is your body's first cardiac stress test? That it actually can be a snapshot of what is to come in your future. Pregnant women can develop high blood pressure and gestational diabetes. After they deliver the baby, their symptoms resolve, often without any specific treatment and often without any specific follow-up preventative plan. And yet these women are at increased risk in the long term of diabetes and high blood pressure, and they have 2 times the risk of having a heart attack versus a woman who hasn't had these complications in pregnancy. Let's move on. What about the inflammatory rheumatic disorders and autoimmune diseases? These are diseases that are markedly more prevalent in women than men. So diseases like rheumatoid arthritis and lupus. What we're finding out is that these diseases have specific and important effects on a woman's heart health. To give you an example, a young 30-year-old woman with lupus has 50 times the risk of having a heart attack versus a woman of the same age without lupus. So we are trying to work together and research how we should be screening these women, how we should be diagnosing, treating, and supporting them when they develop heart disease. And this has led to a new emerging field, which is called cardiorheumatology. And at Women's College Hospital, we have the first cardiorheumatology program of its kind in Canada. And we are hoping to try and answer some of these important questions. Now, did you know that there are certain ethnic and sociocultural groups that are at specifically high risk of heart disease? Take, for example, South Asian women. At Women's College, we believe that we should take leadership in taking awareness and prevention of heart disease out into these communities. So I'd like to provide you with an example, the Medina Mosque study. This was a project that was conducted by our cardiac rehabilitation team, where they took an exercise-based lifestyle intervention out into the South Asian community, into a very religiously and culturally safe space in the community mosque. And this was a program that had full buy-in from the male spiritual leaders of this mosque. Not only was this project completely self-sustaining once they had completed the research component of the project, it turned out the men saw how successful it was, and they wanted to start their own exercise program within the mosque. The next thing I'd like to talk to you about, the next under, is underdiagnosed. We know that women are still misdiagnosed and underdiagnosed when it comes to heart disease at higher rates than men. And this is probably for a number of reasons. As I mentioned, we can present with women's symptoms or atypical symptoms. And we also know that diagnostic tests can be less accurate or sensitive in women compared with men. Now, this is important. If you have a health provider who doesn't understand that women develop heart disease and may present differently, they may miss your diagnosis. To give you an example, literally a few weeks ago, I saw a patient in my clinic who was actually having typical Hollywood heart attack type of symptoms of chest pain. She was known to have an inflammatory rheumatic disorder, and yet her health provider did not believe she could have a heart problem. He did not want to send her for a cardiac stress test. When he finally capitulated, he said to my patient, "I will eat that machine if that test is positive." Now, you probably know where I'm going with this. This woman had critical disease of multiple coronary arteries, and she needed immediate invasive intervention, really to save her life, and will be on lifelong medical therapy. So at Women's College Hospital, we're working to increase awareness and actually try to improve the diagnostic tests we use when it comes to women and heart disease. I'm going to move now from underdiagnosis to undertreatment. Unfortunately, most of the treatments we use when it comes to heart disease have been studied much more extensively in men than in women. We also know that women are less likely to be optimally or appropriately treated for their heart disease than men. And this can be for a number of reasons. Some of them are really quite simple. Again, I want to give you a patient example. A few weeks ago, I saw a woman who was told by her health provider that she was too old to worry about treating her high blood pressure. And this was despite the fact that she was fully independent, highly functional. She had rheumatoid arthritis, and she had a condition called atrial fibrillation, a condition that is caused and worsened by high blood pressure. Now, the last under I want to talk to you about is undersupported. Again, this can happen for a number of reasons. For example, women tend to be nurturers and caregivers and put themselves second. Now, this can really cause problems for a woman when it comes to heart disease. We know that women present on average 4 hours later than men when they develop symptoms of a heart attack, and time is everything. We also know that women are less likely to be referred to and to complete cardiac rehabilitation. These are programs that we know will reduce your risk of a recurrent heart attack and death by 25 to 50%. We're at a critical juncture when it comes to heart disease in Canada, and there's a very big groundswell of support. And we all need to be advocating to increase funding and support for research into all of these unders that I've been talking about. And we can do this together. We also need to be thinking about our own heart health. We need to be our own heart health champions and be advocating for ourselves. So learn about risk factors. Speak to your health provider and make sure that your health provider is informed and they're listening. This is important. And better still, make heart-healthy changes. Reduce the amount of sitting that you're doing. Quit smoking. Get good quality sleep. Eat a good heart-healthy diet and do regular exercise. If I haven't got you motivated already, I want to give you this fact. We know that regular physical activity has long-term benefits for our cardiovascular health and our overall health. What we also know is that you get immediate benefits when you exercise. And these are benefits on your mental health and your heart health. So every time you exercise, you're effectively turning back the clock. So, in fact, if there's an elixir of youth, that elixir is exercise. So at Women's College Hospital, we are working hard to address all of these 5 unders: under-researched, under-aware, under-diagnosed, treated and supported in our women. If somebody says to you, why does sex and gender matter when it comes to women's heart health? The answer is, it may save your life, the life of your spouse, wife, sister, or other loved ones. Collectively, we can make a difference. Vincenza, who you saw in the video, knows that, as does Marianne. When she was talking about her story to us, she said, I owe my life to advances in medical research. I owe my quality of life to Women's College Hospital's cardiac rehabilitation program. Thank you.